Good evening, everyone. This is Dr. Antherica Lane with Lane Women's Health on Demand. I'm so excited to share with you my new online educational platform that's Lane Women's Health on Demand. Tonight we have an exciting show. We're talking about why safe sleep matters. You are going to really learn a lot from the expert that we have on our show by the name of Lauren Everett. Lauren Everett is the Senior Program Manager with Cradle Cincinnati. So get your notebook, get your pens, get your iPhones and your iPads. We are going to have a great time learning about why safe sleep matters. Thank you so much for joining us this evening. Once again, this is Dr. Antherica Lane. I am a board-certified OBGYN practicing in Cincinnati, Ohio at Lane Women's Health. And Lane Women's Health on Demand is my online educational platform. It also is a telehealth business and service that's available at www.lwhondemand.com. So tonight we are going to talk about why safe sleep matters. I'm really excited to share with you this topic, and I hope that all of you will listen to this show, share it with your friends. Go ahead and share it now and let everyone know that you are learning about why safe sleep matters. Let's kind of lay the foundation a little bit for our conversation here. So why safe sleep matters? Let's see here. So there are about 3,500 sleep-related deaths among United States babies each year. And sleep-related deaths include SIDS, many of us know about SIDS, sudden infant death syndrome, accidental suffocation, death from unknown causes, and it's important to understand that many sleep-related deaths are preventable. So to come tonight and talk with us about this is our guest, Lauren Everett. Lauren, how are you doing this evening?
I'm doing really great, Dr. Lane. How are you?
Great. I'm so excited that you decided to join us tonight and share with us some of your knowledge from a wonderful organization by the name of Cradle Cincinnati. Can you tell us a little bit about Cradle Cincinnati? What's the purpose of the organization?
Sure. Cradle Cincinnati was founded in 2012 as a collaborative effort between a diverse group of parents, healthcare professionals, community organizations, and community members, all committed to reducing infant mortality in Hamilton County.
So this term infant mortality is kind of this medical term, but can you kind of break it down for us? Like, what is infant mortality? And can you talk even a little bit about what is the state of infant mortality in Cincinnati?
Sure. Infant mortality is when live born babies die from any cause before their first birthday. It is frequently cited as one of the best measures of a community's overall health because the causes are so multifaceted, a lot of contributing factors. We usually measure it as a rate. So typically the number of deaths per 1,000 live births. So for example, in 2020, the infant mortality rate for Hamilton County was 7.4. So that means that for every 1,000 babies born alive in our community, about 7 did not survive. So when Cradle Cincinnati launched, our community, Hamilton County, had one of the worst infant mortality rates when compared to similar sized counties across the nation. We have definitely made some steady progress since then, with 2020 having the lowest infant mortality rate ever in Hamilton County. However, we still lag behind the Ohio State infant mortality rate of 7.1 and the national infant mortality rate of 5.8. So we want to continue to see that number decline.
So, Lauren, how does infant mortality specifically impact the Black community?
Yeah, locally and nationally, Black babies are more than 2 times as likely to die than all other racial categories. And this has been the case for a very, very long time. Currently, the Black infant mortality rate for Hamilton County is 10.6. So, for this reason, reducing Black infant deaths in particular has been a specific focus of Cradle Cincinnati's partners. 2020 was actually the second year in a row where we saw an all-time low in the Black infant mortality rate. This was a 42% decline since 2017. So we were very excited to see that. But despite these greatly improved rates, we still need to continue these focused efforts on addressing Black infant mortality in our community. We still have a lot of work to do to reach our goal of having every single baby in our community reach their first birthday.
Wow, that's really, really important. It's really helping me to understand the impact that this has on our community. Let's talk specifically about why safe sleep matters. Why is it even necessary to talk about safe sleep for babies, and how does that tie into infant mortality?
One of the leading causes of infant death is sleep. So last year in 2020, we saw the highest number of sleep-related infant deaths in over a decade. And the majority of these deaths actually occurred in Black families. So another disparity there that we're seeing. And unfortunately, we are continuing to see a rise into this year, 2021. The most common cause is suffocation when an adult shares a sleep surface with an infant. This was 75% of the cases in 2020. However, as you shared, Dr. Lane, sleep-related deaths are the most preventable infant deaths. So we are working very hard with a variety of partners to increase awareness and educate communities about the importance of safe sleep.
So, do you think you can review some tips? I always try to be practical when I go online. Some tips that moms and dads can use to ensure that their babies are sleeping safely.
Sure. The easiest way to think about safe sleep is the ABCs: alone, back, and crib. So alone, babies should sleep alone, meaning no bumpers, no blankets, pillows, stuffed animals, toys, other children, or even adults. None of these things should be in the sleep space with your baby. The B stands for back. It is safest for our babies to sleep on their back on a flat, firm surface, not on their stomach or on their side. This lowers the risk of accidental suffocation. And then the C stands for crib. The safest place for a baby to sleep is in a bare crib, bassinet, or even a pack and play. You can always place the crib by your bed so the baby is close by. And just remember that room sharing is safe, but bed sharing is dangerous. And this includes falling asleep together on the couch or even in a chair. So again, ABCs: alone, back, and crib. It's also important to share this information with anyone who's going to watch your baby. Dads are less likely to receive safe sleep education, and safe sleep recommendations may have changed since your parents or even your grandparents had young children. So every person who shares this information and practices safe sleep has the potential to save a life. And we recognize that practicing safe sleep can be hard. It's hard to do at every nap time and at nighttime. So we actually have some tips on our website on how to comfort babies and help them sleep. So these tips can be found at cradlecincinnati.org/safe sleep.
Wow, that is excellent, Lauren. Let's go over those ABCs again. Tell me what the A, the B, and the C, what does that stand for again?
Sure. So the ABCs: alone, back, and crib.
Excellent. Alone, back, and crib. Wow, that's excellent. it's just amazing to think about something as simple as just putting your baby on his or her back can make such a huge impact on their ability to make it through childhood, through the babyhood, if you want to say, if that's a word. So yeah, that's excellent. So Cradle Cincinnati is really connected in the community, and let's talk a little bit about what else are you all doing? What other kind of events or programs that you are doing in our community here in Cincinnati, Ohio?
Yeah, so like I mentioned, infant mortality is a complex issue with various contributing factors. So because of that, we are working on a number of strategies for addressing it. So our efforts include things like providing one-on-one social support to pregnant women and their families, partnering with healthcare centers to transform prenatal care and bring this information to their patients, and even working on policy changes at the local and state levels. I would like to highlight two of Cradle Cincinnati programs in particular. So the first one is called Cradle Cincinnati Connections. This is our team of community health workers, social workers, nutritionists, and even educators that help women navigate services in their community that best meet their immediate needs. And this, they support women before, during, and even after pregnancy. So this could include things like getting a crib so you're able to practice safe sleep, mental health support, breastfeeding support, even help scheduling medical appointments or working to secure housing. So a lot of great things that they're able to help families with. The other program is called Queen's Village. So Queen's Village is an initiative specifically focused on supporting Black women. As I mentioned, Black women are disproportionately impacted by infant mortality in Cincinnati and beyond. So this community was established to offer a safe space for Black women to relax, to rest, and to repower, and really to center Black women's voices in discussions around solutions for addressing infant mortality in the Black community. So Queens Village hosts a range of events throughout the year based on what Black women say that they need. They also recently launched a similar program specifically for Black men and fathers called King's Stand. So there are a variety of events happening on a regular basis, so plenty opportunities to connect and to tap into these resources. There is an event happening tomorrow, actually, that I wanted to mention. So happening Wednesday, August 11th, Cradle Cincinnati Connections has actually been partnering with the local library, the local public library, to host a series of online workshops called Black Maternity Matters. So the next workshop is tomorrow, August 11th at 7 p.m. It's an online event focused on breastfeeding. So all participants that attend this workshop will receive a breastfeeding kit and also be able to hear from certified lactation consultants on tips for breastfeeding and to promote breastfeeding. So you can join that particular workshop or look out for future workshops that Connections may be hosting.
Wow, that is excellent. I just absolutely love Cradle Cincinnati. I really love the holistic, comprehensive approach that you all are taking to addressing that need. And the other aspect is including the dads. There are so many issues related to maternal mortality, infant mortality, where dads can be extremely valuable. So I really like that you all just are being so comprehensive and have such a spirit of collaboration as well in terms of addressing these issues. So Lauren, are you on social media? How can we reach you? How can we reach Cradle Cincinnati?
Yeah, so we are definitely on social media. Cradle Cincinnati Connections, and Queens Village Cincinnati can all be found on Facebook and Instagram. So if you just search any of those names within either of those social media platforms, they should come up. So definitely like the pages, follow, and you can stay up to date on what we're doing and what's happening. And we would love to have you connect with us. You can also visit our website at cradlecincinnati.org to learn more. And we also have a calendar of events on our website as well.
Oh, that's excellent. That's excellent. I'm going to show you all that website one more time, just in case you wanted to do a screenshot of that. That's cradlecincinnati.org. They could be reached at 513-803-4822, or you can hit them up with email at info@cradlecincinnati.org. Well, Lauren, this has been an excellent show. Thank you so much for your time and your expertise. I'd like to give a specific shout out to my husband, Marvin Lane, who has been the technical producer of this show. Myself, I also am a producer of this show, and it is sponsored by Lane Women's Health on Demand. Lane Women's Health is an African-American owned, woman-owned telehealth service available all over the world. And you can find Lane Women's Health on Demand at www.lwhondemand.com. Well, Lauren, thank you so much once again. And I'm sure I'll be seeing you around Cincinnati as we tackle this issue of infant mortality.
Thank you so much for having me. I really appreciate it.